I spent quite a lot of time reading and looking through a report called Time for Change, a practical approach to rethinking police budgeting, which came out in December of 2020. And just sort of on a whim, reached out to the authors of that report and asked them if they'd be willing to come and talk to us. And Shayne Kavanagh automatically jumped on it. He was super stoked about it. We're really thankful for that. Joy Holden is coming in and sort of pinch hitting for a different speaker who was unable to be here today. And we are just really happy to have the Policing Project and the GFAO with us today to go over this report and also to provide sort of the structure of their recommendations about how we can build police budgets that really consider the community need instead of being really prescriptive. So Nashel has their bios and I'm going to let her read those real quick. We're just kind of bouncing around today and then we're going to turn it over to Shayne and Joy for a while. We'll still be in the chat box if you have any questions, and I'm going to put some resources in that box for you as well. At the end, there will be an opportunity for you to ask questions, come off mute and ask them with your voice if you'd like to do that. Otherwise, you're welcome to just sort of stick them in the chat box and I'll make sure that they get some attention throughout the hour together. And we'll be done out of here at 1 o'clock for us. So Nashel, if you don't mind coming back for us. Thank you.
I'm here. Yeah, so thanks so much, Sarah. Like you said, I'm Nashel. I'm the Development and Operations Manager at Empower Missouri. And our two speakers are Shayne Kavanagh and Joy Holden. So Shayne is the Senior Manager of Research for the Government Finance Officers Association and has been a leader in developing the practice and technique of long-term financial planning and policies for local government. So he started at the GFOA in their long-term financial planning and policy consulting in 2002 and has been working with various governments on financial planning and policies ever since. So Shayne has worked with lots of governments of different sizes and different types on financial planning and policies across the US and Canada. And so prior to joining the GFOA, he was actually the assistant village manager for the village of Powells Park, Illinois, where he managed basically all of their financial management operations like budgeting, utility billing, payroll, things like that. And he received his MPA from Northern Illinois University. So next we have Joy, and Joy Holden is a legal fellow at the Policing Project at NYU. She is a graduate of Harvard Law School, where she served as an editor on the Harvard Civil Rights, Civil Liberties Law Review. She also holds a Bachelor of Science in Education and Social Policy from Northwestern University. And as a fun fact, Joy was named a college trial advocacy All-American attorney and is a law school trial advocacy national champion. After her fellowship year at the Policing Project, Joy will clerk for Judge Leo T. Sorokin of the United States District Court for the District of Massachusetts. So that's a bit about who we'll be listening from today, and I will let Shayne and Joy take it away from here.
All right. Hey, thank you for that introduction. We appreciate it. And thank you, everybody on the call, for taking time to chat with us today about police budgeting. I'm always very excited when I can find someone to talk about budgeting. It's a rare crowd that will join us on a Friday afternoon to do this. So we're going to jump into the presentation here. I think what you'll find is that Joy and I are taking a joint approach here, where I'm going to lead it off, and then Joy's going to follow up with some of their materials from the Policing Project about how the kind of concepts I'm going to talk about lead into the work they're doing with communities all over the United States. So with that, you can hopefully see my screen right now, and we're going to take it away with just one technical issue. There we go. All right, so the plan for the presentation, we're going to start out with what is financial foundations for thriving communities, because you might have seen on this last slide, this is all about financial foundations for thriving communities and its connection to the public safety budget. So what do we mean by financial foundations for thriving communities? We're then going to see how we apply that to public safety funding, and then we're going to get into what we're going to call our first pillar of better budgeting, establishing a long-term vision. Because as you might guess, police and municipal budgets are complicated topics, and I think a good way to approach a complicated topic is to break it down into bite-sized pieces. So the first bite-sized piece we're going to deal with here today is establishing the long-term vision. But let's begin with what is this financial foundations for thriving communities. And the way I like to describe it is with a parable called the tragedy of the commons. Some of you may have heard of the tragedy of the commons, but some of you may not have heard of it. And for those that haven't heard of it, it goes a little something like this. You've got a group of farmers who all collectively own a grazing area. So in our little slide here, we might imagine that our 4 farmers, and we'll call them farmer A, B, C, and D, all collectively own this grazing area. Because they all own it together, they all have a similar incentive. And that incentive is to send their animals onto the grazing area as much as possible. Because if, let's say, farmer B doesn't send their sheep to the grazing area, everyone else is still sending their animal onto the grazing area, and their animals are getting fat and happy. Well, this guy's sheep is sitting at home doing nothing. But instead, everyone sends their animals onto the grazing area as much as possible to kind of get their piece of the pie. And the result over time is this: the grazing area is grazed down to nothing, becomes barren, and the whole thing is destroyed. And you have what is called the tragedy of the commonly owned grazing area. Now, our premise is that the local government budget is very similar in that the local government budget is owned by all the different stakeholders in the community. So that could be different community groups, different neighborhoods, even the departments and staff within the government itself. They all own the local government budget together. And because they all own it together, they have that same incentive: get your piece of it, because if you don't, the next guy will, and you'll be left out in the cold. So everyone's trying to get their piece of the pie, and over time you're left with this: the tragedy of the local government budget, right? The budget can be worn down and eventually depleted. Now, fortunately, there is a lot of research about how to solve this problem in the natural resource world, and we've translated that work to public finance, to how to have sustainable, good decision-making around public finance resources, including public safety budgets. So here is the framework that we use, called the Financial Foundations Framework. And this framework can be used for addressing really any collective resource problem in public finance. And we're going to be talking about public safety budgeting as a collective kind of resource problem that we want to solve. But I'll just briefly go over here the 5 pillars that are part of our Financial Foundations Framework. The first pillar is establish a long-term vision. So the idea here is you need to give people a reason to cooperate. If everyone is just focused on the short-term budget, right, they're not going to be able to kind of look up from their immediate interest in towards the future. So just to take our farmers have said, well, we're only really concerned about what goes on in this grazing area next week. Everyone's going to be like, well, I still want my piece of the pie. I'm sending my animals onto that grazing area no matter what. But if we're worried about like the health of that grazing area years to the future, well, now it's a different story, right? And if you think about communities and public safety, right? If, well, we're just worried about this year's budget, am I going to be able to fund like, this number of officers? That is not going to be conducive to like a discussion about real reform. But if we're thinking about kind of what is the long-term health of the community and what role does public safety have in it, that might open up some doors for thinking differently about this. We then kind of can move to pillar 2, which is building trust and open communication. So let's go back to our farmers. If the farmers, none of them trust each other and they don't talk, it's going to be very difficult to come to a solution to solve that grazing area problem. Same thing in public budgeting and police budgeting. If the different stakeholders don't trust each other and they don't talk, it's going to be very difficult to come up with a solution to public safety funding for the community that is good for everybody. And that really ties to our next one too, which is use collective decision-making. This really is pretty simple. Decisions that are made together are going to be a lot more durable than the solutions that are imposed from the outside. So in our farmer example, if all the farmers got together and came up with a solution to how to use the grazing area, that's going to be more durable than if someone comes from the outside and says, hey, you farmers ought to do this. And so in police budgeting, right, can you get community groups, the police themselves, all the different stakeholders at the table to think through what the best way to approach the public safety needs of the community are. Pillar 4 is create clear rules. So you have to have rules to govern how the system operates in the world of our farmers, right? They have rules to say, well, farmer A gets to graze on Monday, B on Tuesday, something like this. Same thing happens in the world of police budgeting and public safety, where you need to have rules that describe how the budget is going to be allocated and how it's going to operate. And we'll actually touch on some of that in the presentation I'm going to get into in a few minutes. And then lastly is treat everyone fairly. And so, as we say on the slide, you need to promote and protect mutual trust and respect, because if someone feels unfairly treated, they are not going to support the decision-making system. So in our farmer example, if farmer D feels like, hey, I'm really getting the short end of the stick of the arrangement that we've come up with, they might sneak into the grazing area at night and have their sheep go on when they shouldn't be on there. Kind of same goes with the budgeting approach here. If some group feels like they've not been fairly treated, right, they're not going to work to uphold the decisions that were reached about the budget. So you want everyone feeling fairly treated and part of the decision-making process. Now, kind of one more slide before we start getting into some of the detailed application here is one of the reasons that we think this particular approach is valuable can be summed up here in our little 6 conditions of system change model. So the 6 conditions of systems change breaks these things down, these conditions for systems change, into you see these 3 levels on the slide. You've got structural change at the top. You can think of this as like above the waterline. This is the thing that people see most easily and tend to first reach toward when we're talking about changing a system. So that's like changing policies, maybe there's policies about how police operate or practices, or in this case, resource flows. Let's change budgets in the police department, right? Very structural type of stuff. And the below the waterline, though, is very important and is not as easily seen and is often not as well addressed, right? And that is things like relationships and connections and power dynamics. The 5 pillars, the financial foundations, address these directly, right? Because if we talk about, let's say, collaborative decision-making, that's a power dynamic, right? Relationships and connections, that's trust and open communication. So the 5 pillars are really addressing these 2 items here directly. And then lastly, which is associated with transformative change, is the mental model. And the mental model is how you view the world. And the typical way that a budget is viewed is as a win-lose game, where if I get my piece of the pie, someone else doesn't get their piece of the pie. And that's the tragedy that commons. What we're saying is there is an alternative to that, and that is the financial foundations approach, which is a different model for how to view the local government budget. So what I'm going to do with the rest of my time is get into some details here on pillar 1, which is establishing a long-term vision. So we're going to kind of see how that's important in the public safety concept or in the public safety context, and how that's been applied in other places, and hopefully give you guys some takeaways about how this can work in real life. So let's first get into the need for a long-term vision. So some of you may be familiar with something called cure violence. Cure violence is an approach for dealing with street-level violence, and it's based on a new mental model for community violence that has epidemiology, right? So instead of a pure law enforcement model, which is the use of force and enforcement of the rules, cure violence is treating community-level violence like a disease, right? Where it spreads along vectors, and you can interrupt those vectors by intervening with people who might essentially be spreading the violence. It's proven to work in a number of different places, so it's well proven by evidence and research. But what's interesting is because it's based on an epidemiological model and not a law enforcement model, it is not best housed in the police department, right? Because the police department, their mental model is enforcement of law, use of force. It's best located in a public health department, but can the organization get there in 1 year? Because most public health departments, if the city even has a public health department, are not set up to really house and run a program like this. So you need a long-term vision to do it. And I was actually had run into the founder of this program just by kind of luck at a community meeting. And we were just chatting, and he was talking about the difficulties that he was having getting funding for the program, and it was like a budgeting 101 course, and it really spoke to this point of that, like, there's a different mental model behind cure violence that is not compatible with the kind of traditional departmental view of how budgeting is done. And so therefore, this is where the need for the long-term vision comes in. And I'm going to show you just a little example here. This is from Chicago. And what we see is the number of shootings going down over time, but eventually the program ceased fire. And it says the slide here that I pulled is mistaken. It is currently called Cure Violence and always was called Cure Violence. So it still is Cure Violence. But the point is, it was cut in March 2015. And this is, when I was talking to the founder, there wasn't really this long-term vision in place for how Cure Violence fit in. It was just sort of like, well, it's this program that sounds nice. We'll just kind of have it in there somewhere. But it eventually just kind of lost funding as it didn't, again, fit into the mental model. And you see the number of shootings begin to rise, right? So this is a very unfortunate example of the need for a long-term vision in public safety, because if there was a long-term vision that said, well, we're going to approach street level violence in this new and proven way, perhaps it could have been possible to find a place within the institution where Cure Violence could have been housed that would have been more conducive to its long-term funding and success. Now, the good news is that Cure Violence has been having a lot of success recently in lots of communities. So kind of these issues are being worked out, but I think this just gives a good example, snapshot in time of where the lack of a long-term vision had tragic consequences. So now, of course, public safety is a lot more than police. So if you guys are interested in further reading on this topic, I might suggest this report from GFOA. It gets into the city of San Antonio and its 2020 vision. I think this vision is pretty cool because it is a vision for a broader scale transformation of the community in San Antonio, addressing things not like just public safety, but things like education, economic, health, mobility, all those things that you need to have a thriving community. And what's most exciting about it is it survived 3 changes in mayoral administrations, right? So anytime anything in local government survives 3 changes in mayoral administration, I'm interested. And one of the reasons that happened is they had, I think, about 3,000 to 4,000 San Antonio residents as part of the process of creating the San Antonio vision. So this wasn't just a vision of the mayor who kicked this off, it was the vision of the entire San Antonio community. So I think a real lesson here for people that are interested in public safety reform is how do you kind of weave this into a broader vision for community thriving, and that vision is kind of co-created by not just the mayor, but all the different stakeholders in the community. It's something that is durable over the long term. Again, this report gets into a lot of the features and factors that made that vision so durable in San Antonio and other communities that have done similar things. All right, the next point I want to bring up here is this idea of day-to-day lived experiences. And the idea is that we have to recognize that, though the long-term vision is very important, there are also day-to-day lived experiences that people have that are going to potentially prevent them from really thinking about the long term, right? Because if you're preoccupied with, like in my example here, use of force, you're not going to be really so interested in talking about what happens years in the future. So part of the vision, you also need to be thinking about, well, what are day-to-day things that we need to be talking about right now? And this is actually a great example from the policing project's work of a use of force policy, where they reviewed a use of force policy with the community and came up with a new policy that addressed a lot of the different concerns that people had with use of force, and kind of this is served as a prerequisite or a tool to help start making the space for a broader conversation about public safety. So the next point I want to get to is the establishing a set of measures and facts on the ground about how things are working out right now. And so the kind of starting point here is that this shared set of facts about the status quo is going to be the basis for envisioning a better future and defining long-term goals for public safety. So goals that are measurable and specific and about when they are going to be achieved really support better budgeting, and having these measurable goals enable local officials and the public to monitor progress and track which programs and initiatives are work and which ones do not. And then by figuring out what's working, what's not, you can then put resources to where they need to go. Now, I think the kind of real key here, and probably I think a big takeaway for folks listening in, is that many of the traditional measures for public safety that go into budgeting and planning don't really lead to great decision making, yet are often prominently featured in budget documents and influence budget decisions. So let's just give you an example. Police headcount is a common measure, right? Because it's easy, right? We can count how many police officers are in the police force. Pretty simple. And there is it's not entirely clear though that headcount reduces crime. Of course, there's probably some minimum number of officers you need to accomplish the work of policing, but measuring headcount is not really going to help you kind of think through, is the public safety goal being achieved at a really meaningful level? And if it's not really helping you at that meaningful level, how valuable is it, right? So there's probably better opportunities than thinking about just headcount as a measure. We also have crime rates on here. That's another common measure, but the question there is, well, what counts as a crime, right? Just to give you an example, right? Homelessness has been criminalized in many places, and if that's part of the crime rate, is that a good measure? Probably not, right? So we'd have to think about what goes into crime, if that's a useful measure or not. And then lastly, perception of safety, and the idea here is that that people's perceptions matter, but perceptions are not necessarily tied to reality, right? So people's perception of crime has gone up in eras where crime has actually gone down in reality. So perception, not always a useful measure either, but these are traditional measures. So the question is, for people that are interested in police reform, can we find better measures that lead to better, more informed decision making? And so on this next slide here, I have a few measures I might suggest could be better measures. So response time to calls could be useful, because this is really links to police's role in responding directly to crime and resource use. It can also be disaggregated for different types of calls and demographics and geography. Community trust in police, I think that's a good one, because it gets right to the heart of many of the concerns that some members of communities have with the police. So that could be an excellent place to get started with. And then this one I've got starred. Clearance rates, particularly around violent crime, is very interesting, because on one hand, it does have a better connection to actual public safety than the crime rate. But what I think is interesting about it is that this is a remedial measure, right, where you're responding to crime that has happened. But what if something like our Cure Violence program has been totally successful? There would be less crime to respond to, right? So you have to also be careful to make sure your measures are not assuming like a kind of remediative approach to crime, and that you're giving space for preventative approaches like Cure Violence. Now, fortunately, the clearance rate is not not a measure where it would be kind of get worse if there were kind of fewer crimes, because it's a rate. You could still have a good rate even if you had a low number of crimes, but just to point out that you also want to have space and be giving attention to the fact that your measures want to encourage preventative thinking, not just responding to things after they have happened. And then lastly is representativeness of the police force, and kind of the representatives could be useful for increasing trust, making sure the police force is adaptable to changing needs and things like that. So another potentially useful measure. So I'm going to close out here with my last slide, and that slide is really kind of thinking about different questions here that you might kind of be able to ask to move along the conversation when it comes to pillar one. And that is, what concerns do people have with day-to-day lived experiences? We gave the example earlier of the use of force policy. Are there prerequisites that you need to address before having conversations about money and funding of police, that to give people space to think about that. Number two, is there a long-term vision for police and public safety? Are you including all people in the community? Do you invite and empower other organizations to get involved in that vision? Thirdly, have you brought stakeholders together to agree on a common set of facts about police and public safety? And this is where those measures come in, right? Well, what is the current state of those measures? Are we measuring the right thing? Which direction we need to be going in terms of getting those measures to start trending in the direction we all want them to go on? And that kind of leads to our fourth point, is kind of over the long term, where do you all kind of want to see public safety going as a total community? So with that, I'm going to hand it over to my colleague Joy, who's going to talk a little bit about the work of the policing project and actually how they've seen some of these questions getting answered across the country. So Joy, I'd like to hand it over to you.
So I'm going to interrupt a quick bit. Someone has had a definition question. So could you explain what clearance rate means?
Absolutely. So clearance rate essentially means if there is a crime, is that crime solved? So if you had let's say 10 crimes and 10 were solved, you would have 100% clearance rate. Is a simple definition.
All right, take it away, Joy.
And Joy, I'll stop sharing here.
Go. Can you all see that? Great. So thank you so much, Shayne. And I'm really happy to be here. Just a point of personal privilege. So much of my family on my dad's side is from North St. Louis. So I care a lot about St. Louis and Missouri, and really happy to be here. So my name is Joy Holden. I'm a legal fellow at the Policing Project, and I'm working on the Reimagining Public Safety program, which I'm excited to talk to you about today. So the premise of RPS, or the Reimagining Public Safety program, is that our current approach to public safety just isn't working. And that's a premise that's shared widely. It's shared by community members, it's shared by law enforcement, and it's also shared by government. And also, we're simply just asking police to do too much. We're asking them to do things that they're not trained for and things that they're not qualified for. So the essential question that's posed by RPS is, what is a cop doing here? And you can sort of read that question in three distinct ways, and I'll go over them with you. First, what is a cop doing here? So is that person the right situational actor? What sorts of training do they have in their jobs? So you can see here is a chart that talks about academy training hours. A lot of that training time, up to 70% of that training time, is in force and law. You can see 43%, that gray section, is law enforcement training, 27% is training in force, and only 7% of the training that police officers get are in things like social work or mediation. So you would expect that to be a much higher portion of how police officers are trained. You've got basic skills accounting for 19%, and sort of emergent non-law things like fires and floods and things like that account for about 4%. So the next way we read that question is, what is a cop doing here? So regardless of what they're trained to do, regardless of what their background is, what are they actually doing in a given situation? So not actually a lot of force and law. You can see that the majority of what police are actually doing, the situations they're actually responding to, are traffic accidents, disabled vehicles, domestic arguments, alarms. So those are actually not mostly related to crime fighting. And so the final iteration of that question, what is a cop doing here? What sorts of situations are we putting police officers in? And are they the right people to actually be in those situations? We see that there are sort of two innate harms with that mismatch response. When you're trained in force and law, over 70% of academy training, and what you're actually doing is responding to non-law enforcement activity like animal control, for example, or traffic stops, we see two main harms. First, the innate harm of policing, harms that come from prosecution, harms that come from breaking up families, things like that. And then the second harm is it actually fails to solve the problem that actually someone called about. And we know that those affect Black and Brown communities more than others. So that brings us to, my job. Like, where do we come in? What is the policing project doing about that sort of mismatched harm? So we are in 5 different jurisdictions across the United States, in Denver, Minneapolis, San Francisco, Tucson, and Chicago. And so we are implementing our Reimagining public safety project there. Sort of going along with Shayne's pillars, this is the first and second pillar. So we're trying to get community involvement and community engagement in figuring out what is public safety, how are people going to feel safe, and how are government actors going to help to implement that safety. So our research team is broken into 3 different categories. First, the qualitative community category, which I'll talk about, where we talk to community members, get buy-in, figure out what do people want and how to give it to them. And second, the public official response. So talking to mayors, talking to city council people, talking to police officers and dispatchers as well. And then the quantitative aspect. So we're getting calls for service data and other quantitative metrics to help us flesh out the qualitative data that we're getting. So we thought it was really important to take a community-centered approach to our research. These photos here were taken in Denver, Colorado. That's where we've really rolled out the first aspect of our project. This project has been implemented by Dr. Tamra Leach. She is a professor at Montclair State University, and these are some of our emerging findings. So first, interest in reform is really high in Denver, at least. We know that the perceptions of police are not great. As you can see at the top here, many people said, why would I call someone who hates me to help me? 58% of people in our study thought that police were biased, that they were unfair, that they discriminate, and they would hesitate to call 911 in an emergency. So that was the community-based aspect. And we also have a first responder and frontline worker aspect. That's being led by Dr. Jessica Gillooly and Dr. Brenda Forrester at Suffolk University in Boston. So the STAR program I just want to tell you a little bit about is really what we've been studying in Denver. It's an alternative response program to the traditional police function. It's the support team assisted response program. It was launched in June of 2020. And so it works with the police department, the Mental Health Center of Denver, and Denver Health. And they're helping people with mental health problems, substance abuse problems, and poverty and unhoused situations. So this is a totally non-police response. It's not a co-responder program. They're not sort of going to calls with a police officer, but these are mental health clinicians, social workers, psychologists, EMTs that are going by themselves to address a situation, to try to, help someone out of a situation. So the biggest finding that we've had from our study thus far is that 0 number at the top, that 0 of those calls resulted in arrest or need for police assistance. So in the 18 months since June 2020 that the STAR program has been implemented, none of the calls have actually resulted in arrest, which is huge. But, you can see the number below, only 1 out of every 3 qualifying calls actually went to STAR. And this is actually a police and community budget issue. So when STAR was implemented, there were only 2 vans. So there were 2 clinicians in each van in the whole city of Denver. So when someone would call and say, I'm in crisis, I might want to kill myself, or I'm in crisis, You know, I need to be taken somewhere. I need to go to a rehabilitation center. If it was after certain hours, STAR only ran from 9 to 5. So if you called at 6 p.m., you would get a police officer. You wouldn't get a STAR personnel. The same is true on the weekends. You know, STAR wasn't running on the weekends. They didn't have the budget for it. They didn't have the people for it. So definitely in Denver, the residents really wanted STAR, liked the ability to have a non-police response, and the budget really prevented them from having that. So some context. We've spoken to a lot of 911 dispatchers, STAR supervisors, as well as STAR responders. 911 is at a breaking point right now. There's staffing issues, as you probably know, basically everywhere. But in 911, you know, many places are at a 50% capacity. We see 49.5% effective staffing. People are calling 911. They're waiting multiple times a day. They don't have the right personnel. As you can see here, the dispatchers are at a mandatory 12 hours a day. So that obviously is a problem in dispatching. And so I want to give it back to Shayne to talk a little bit more about the other pillars, but I welcome your questions if you have any about this part of the project.
Yeah, I think Joy, I did see a question in the chat about, where was it? Is the research mainly focus groups or interviews when that was in response to the, I forgot which slide, but the slide about the like attitudes about that sort of thing.
It's absolutely both. So our community qualitative aspect has focus groups. So in Denver, we had a 2-day focus group that had members of the community come in and discuss their feelings around public safety, where we got many of those community quotes from. And then we also have one-on-one interviews with community members, one-on-one interviews with STAR dispatchers, with police, with first responders. So we've got both.
Yeah, that's great. And we would definitely be happy to open up to questions from anybody else at this point. So our organizers would be good on time if we have some questions from people.
Yeah, absolutely. We're great with that.
All right, cool. Well, please do let us know if you have any. And then here, I'll just Joy had mentioned the other pillars. So that's just if you need a reminder of what those pillars are and you have questions about any of them, please feel free. But I think you also noticed that the last stuff Joy was bringing up, right, starts to talk about and get into some of these other pillars, right? The collective decision making, bring all the community members together to start kind of getting attitudes about police, and really begins to bring all these pieces into the total picture for addressing police reform.
So we do, sorry, Joy or Shayne, someone did ask, do you know what type of model St. Louis is using or suggesting? I don't know if you're familiar with what we're doing in St. What's happening in St. Louis.
Not familiar with that, no. It's probably worth mentioning though that there are, and Joy, jump in here, many models that are, I would say, not exactly the same, but like, we'll say like working towards this goal of having like mixed response to different calls, right? With like Cahoots, I think would probably be an example. So there's many different models of this mixed response that are proven successful. So hopefully the mayor is considering one of those.
And for those who don't know, the Cahoots model, it was implemented in Eugene, Oregon. It was one of the first alternative response models that sort of had a broad scale. And so we have done work with Cahoots, and many of the alternative response models that we are studying are based on Cahoots. STAR, for example, is based on Cahoots as well.
Sure.
So,
all right. Good.
I was going to say, we have a question from Jessica. Are you all suggesting money should go to a certain space, or just how to get stakeholders together to decide where to put the money?
Yeah.
Yeah.
Sure, happy to address that. So in today's presentation, we are focusing on the vision, which is more about getting the stakeholders together as a first step, because I think it'd be very challenging for either GFOA or maybe not just challenging, impossible for the GFOA or the policing project to be overly prescriptive on where the money goes. Like, so just give you an example. I talked about cure violence early on. If community violence is a problem in your community, this might be a really good investment, right? But in other places, maybe it's something else that, like, maybe it's more of a mental health sort of situation. And you might not be better off investing in a program like Joy was talking about. So the community vision, that's why the community vision is so critical. We have to define the problem first, right? A lot of times, as we see this over and over again in our work, is that people want to jump straight to the solution. I think I've heard it said, a problem well defined is a problem half solved. So defining the problem first is super important, and that's what the vision is really doing, is then you can put the money to where it needs to go.
Yeah,
And that's why
absolutely.
oh, sorry, Joy, go ahead. I didn't want to interrupt
No,
you.
I was just going to agree. I couldn't agree more. We've seen in the communities that we've worked in that different communities have different problems, and there would be different solutions for all of those problems. A rural community is going to have different needs than a city. A county that's a city county is going to have different needs than just a city. So, you know, it definitely depends on the community.
Yeah, that's why I really liked this report, and why I wanted to bring you both here to talk about it was because I just there's no outside influence that should be telling our communities how they should manage their police budgets, or like, here's the right way to formulate where you put resources. The fact is that our communities know what they need. Our communities are connected in a way that those of us outside of it can't ever be. And so that is, you know, back to what's happening in Missouri, what's particularly egregious about the state legislature trying to control the police budget for Kansas City, many of them who have spent zero time in Kansas City and certainly don't live there. So yeah, I appreciate that a lot.
Sure. And I see a question about what funds 911 police budget or another budget line. I think that varies quite a bit from location to location. There are like 911 surcharges, you know, sometimes in phone bills, there's general taxes to pay for it. And it could be located in the police department or located somewhere else. So it just tends to vary quite a bit, honestly. And I think what's very interesting about that, and Joy, jump in here, because I think this is definitely in the policing project bailiwick, is the need to, what's the word I'm looking for, like strengthen the kind of 911 function, right? Because if you're going to have a program like Joy is talking about, the 911 call takers have to become more discerning or better able to discern of like what the nature of the call is to send the right people. So I think that's a very underappreciated element of this whole thing, is like, you might have to spend more on policing, not less, to like get the reforms you want. Because if you're like, hey, we want to have like a kind of more customized response, well, then the call taker needs to be able to figure that out, and you're going to need like more skills and abilities at that point in the process. But Joy, please jump in here.
Yeah, absolutely. What we found, which was so surprising to me, was that the 911 dispatcher is almost the most important actor in a given interaction, just because the dispatcher is hearing what the call taker is saying and putting that call in a given category. So you know, that person has a lot of discretion, of course. If, you know, hearing, you know, does a person that needs help have a weapon, that's going to send a different response than a non-violent, sort of in crisis or person with a weapon, which of course can determine what kind of police response or non-police response is given. So that person is really the judge and the jury a lot of times in determining what actually outcome is going to occur.
Oh, great. It looks like there's a follow-up that might be up. I think Joy addressed there in the chat. It's about social workers.
Yeah, should social workers and others with a social and behavioral science background be part of call center personnel? I mean, you know, I think that is a great idea. There's a lot of discretion, like I was saying, that goes along with taking calls. No one wants to be a call taker right now for, you know, a myriad of reasons. But, you know, I think that people with good judgment should be call takers, and whomever that may be.
Yeah, and I think what's kind of interesting too, Joy, that, you know, at least the kind of the conversations I've been part of with the project, is this is an unknown area, right? So the thing that is, I'm saying unknown, it's an area we're all working to learn more about, because this is a new thing, right? And so no one's kind of got the magic formula for how dispatch ought to be structured to address these kind of emerging public safety approaches. And, like what might also ultimately need to happen is kind of better use of algorithms part of this, where, because people are fallible, this is a very stressful job. Can we help make their lives easier with like different automations that help direct calls in the right place and aid human intervention is another kind of, I think, thing that's come up as a possibility anyways.
Well, Shayne, we might disagree a little bit on the use of algorithms in call taking, but I'll wait for the next question.
So actually, I think this question will be the last one. So if you do want to like take a quick second to flesh that out a bit, I'm sure we would love to hear kind of your take on the use of like AI and things.
Sure. I mean, it's an incredibly complex issue, and it's very new and evolving. So my background is not really in social science. My background is in law, and at least in other contexts, the use of algorithms in, bail determinations, for example, has been not great for people who live in, a given zip code, people who may have been formerly incarcerated. So I think that an algorithm is really only as good as the programmer, and often when the use of algorithms can be just as biased as the use of a person, and a person can sort of hear intonation and can sort of make a judgment call, which of course has its own issues, but at least now I think I trust humans a little bit more than I trust a rigid algorithm when it comes to criminal justice.
Sure. And just to be clear, I am not like pro algorithm. I was just saying that it was part of the conversation that, this is debate that is happening as to like what role should algorithms have. But given that, just for fun, because this is a good conversation, I'll take the other side of the argument. The kind of, other side of the argument is something called the beat the bear fallacy. And it goes like this, where two guys are walking through a forest. One of them says they pass a sign that says, "Danger, bears in the woods." So one guy puts on his track shoes and the other guy says, "Well, you're not going to be able to outrun a bear." He says, "I don't need to outrun a bear. I just need to outrun you." And that's kind of like the problem with algorithms, is that like people say, well, the algorithm is not perfect. The algorithm doesn't need to be perfect. It needs to be better than human judgment. And study again and again shows that algorithms in many applications beat human judgment. It may not be perfect, but it will be better than the human. So the question could be, right, well, to what extent can this algorithm be optimized to outperform humans, right? You could kind of, with judges, like it's shown that a judge is like basically their judgments are influenced by, did they have lunch or not? Did they like kind of fight with their wife this morning? You could actually take a judge's judgments and build an algorithm that will outperform the judge itself by like factoring out those types of biases. And so the question is, could you do the same thing, with dispatch? And it doesn't have to be algorithm or human. It could be both together, right? Like, so it could be algorithmic aided dispatch too. So these are just debates that are happening, and we'll have to see where it all goes.
Yeah, that's clearly well above my pay grade, but it seems like there's, a middle ground, right? This is still what's so important, is that the people who are on the other end of the line when you call are people who know your community well, who understand who lives here, and who are ready to well respond to those issues in a way that's informed beyond just, here is a year worth of schooling, right? Here is some time that you spend in a formal education setting. Instead, really looking at people with lived experience and making sure that they are in positions where they can help determine those kinds of things, like who goes to this call that happened in my neighborhood instead of, a neighborhood I've never been in. So I really appreciate you both and your time and the conversation today. That has been so helpful to help us flesh out what we're thinking and to share more education with the folks who showed up today. There's some information in the chat box for folks who might need CEUs for today. We do offer those. You'll need to fill out that survey and reach out to Christine to get those CEU certificates for today. We also have an upcoming in the first week of April 4th through 7th. Empower Missouri is going to host a week of action. We're going to have people in the Capitol building again for the first time in 2 years. We're very excited about, as well as lots of virtual offerings for folks who do not wish to do that. And we are co-sponsoring that with the Missouri Community Action Network. And so we are really excited to have folks really speaking with their lawmakers around issues of poverty. We'll be back here next month to talk about the initiative petition process and how that functions in Missouri and what we can do to protect it. And that's the entirety of our offerings for today. Shayne, Joy, again, thank you so much for your time. I really appreciate it. And we'll send you off into your afternoon.
Thank you for having us.
So much.
See y'all in March. Bye.